So today we'll be discussing some spinal cord syndromes. The first one is anterior cord syndrome, which begins with the loss of pain and temperature below lesion due to its effect on spinothalamic tract, and there is weakness. There is bilateral motor loss due to affected corticospinal tract, but there is intact proprioception and vibration as dorsal column tract is spared. So the cause is anterior spinal artery infarction, trauma, and disc herniation. So I've got a mnemonic here for you for anterior cord syndrome. That is, an ant crawls under your skin, burning it, pointing out to the pain and temperature loss, paralyzing you, pointing to the weakness, but spares your ability to balance. That is, the proprioception is intact. Coming to posterior cord syndrome, where there is loss of proprioception, vibration, and fine touch as dorsal column tract is involved, and there is intact pain and temperature as spinothalamic tract is intact. Causes are vitamin B12 deficiency, MS, multiple sclerosis, and Tapes dorsalis. So the mnemonic here for you is: imagine a post holding up your balance, that is a proprioception, but breaking apart, leaving you unable to sense your position. So there is loss of proprioception, vibration, and touch, but the pain and temperature is intact. Coming to central cord syndrome, where there is weakness, there is weakness in the upper limb and lower limb due to cervical gremator and loss of cape-like pain and temperature sensation, as it involves the crossing over of spinothalamic tract fibers, that particular point. Coming to causes, syringomyelia, hyperextension, injury. The mnemonic here is: if cape gets stuck, leaving your arms weak, upper limb more than lower limb, and numb to temperature. Coming to Brown-Séquard syndrome, there is ipsilateral weakness, loss of proprioception and vibration as corticospinal tract and dorsal column tracts are involved, and then there is contralateral pain and temperature loss as spinothalamic tract is involved. The cause is trauma, tumor, and ischemia. So there is ipsilateral weakness, loss of proprioception and vibration as it affects both corticospinal tract and dorsal column tract, where there is contralateral loss of temperature and pain. So the mnemonic here is: a knight with a bronze sword cuts one side, that is ipsilateral motor loss and proprioception would be affected, but feels fire from the other side. And this indicates that the contralateral pain and temperature sensation is lost due to its involvement of spinothalamic tract. Coming to next syndrome, that is conus medullaris. There is symmetrical weakness, saddle anesthesia. Early bowel and bladder dysfunction, trauma, and tumors. And here the mnemonic is: the cone in the center spells causing symmetrical saddle numbness in early bathroom accidents. Coming to the last spinal cord syndrome, that is cauda equina syndrome. Here there is asymmetric, as opposed to the conus medullaris, asymmetric lower limb weakness, severe radicular pain, and late bowel and bladder dysfunction. Causes are disc herniation, spinal stenosis, and tumors. So the mnemonic here is: a horse's tail is injured asymmetrically with pain radiating down on one leg and delayed bathroom troubles. Okay, hope you enjoyed the session. Thank you.